Clinically, I think that the 4.4-month difference is important for our patients. Statistically, with a p-value of 0.051, it did not reach a statistical significance with a p-value that should be less than 0.05. However, I think it's also important to recognize that this was a secondary endpoint, and the study clearly was not powered to look at a small difference such as this. So for me, though, clinically, I think I look at more at what the median overall survival was for these patients, and I also look at the durability of that response. And I think patients receiving talimogene laherparepvec had a very durable response. And I look at the survival curves, and we can clearly see, as was presented, that the survival curve for talimogene laherparepvec tend to flatten out. So you have a durable response. The other thing we also looked at, which I think is important to recognize, that as we now have multiple new treatments for melanoma, many patients who progress on one treatment go on to a second therapy. And many times those second therapies will also influence the overall survival for patients. And if we look at that specifically, we know that patients who went on other therapies in the two groups, either in the talimogene laherparepvec group or in the GM-CSF group, they seem to have similar therapies that they went on afterwards. In addition, there are also other factors that may influence potentially the survival, and these are not necessarily things that are stratified for. And we also wanted to do a sub-analysis for that to see if any of those factors may have influenced the potential overall survival. And we found that in the talimogene laherparepvec group, the number of patients with stage 4 M1b and M1c disease was slightly higher compared to the GM-CSF group. And we do know that patients with a slightly later stage tend to do worse compared to the patients with an earlier stage. We also found that the functional status of the patient, the ECOG status, was more ECOG 1 compared to 0 in the talimogene laherparepvec group versus in the GM-CSF group. And these may potentially have influenced the differences in survival as well.